Hello, my name is Dr. Alan Detton, and in this lecture I will be going over the muscles of the upper limb. By the end of this lecture, you should be able to identify and describe the actions of the extrinsic muscles of the upper limb. Identify the muscles of the rotator cuff and describe the joint action of these muscles. Identify the muscles within the anterior and posterior compartments of the arm and describe the actions of each. Identify the muscles within the anterior and posterior compartments of the forearm and describe the collective actions of each group. And lastly, identify the major structures within the hand. Before we start taking a closer look at the actual names of muscles within the upper limb, I want to first introduce the concept of how the muscles are organized within this region of the body. Now, the first thing to notice is some of the muscles are going to be found within the upper limb itself, and these are going to be considered intrinsic, meaning that they start and stop within that region of the body. Another group is still going to affect movement of the upper limb, but they will begin outside of this area, and then they're going to insert or end within this region of the body. And these are known as extrinsic muscles of the upper limb. So some of the large dynamic movers of this region or appendage are going to be considered extrinsic muscles. Some of these in particular are going to originate from the scapula, or the bone of our shoulder, and insert in the humerus, or the bone of the arm. And these are considered scapulohumeral muscles, and we'll take a closer look at them as well. The muscles of the arm itself are going to be divided into two categories, those that are going to be in front of the bone and those behind, otherwise known as anterior compartment muscles and posterior compartment muscles. Similarly, the muscles of the forearm are going to be divided based on their orientation with the two bones in the forearm, the radius and the ulna. Therefore, similarly, we're going to have a group of muscles in front of or behind known as anterior and posterior compartment muscles respectively. The last muscles we're going to take a look at are going to be the muscles in the hand itself, which will be subdivided based on if they affect movement of the thumb or the little finger, or collectively affecting the different digits within the hand. The extrinsic muscles of the upper limb can be subdivided into three different groups based on their orientation or sites of muscular attachment. The first of these are the anterior Axio-appendicular muscles, and as their name would imply, they are going to be attached more anteriorly on the thoracic wall, and they will begin at the axial skeleton but insert on the appendicular skeleton. Their counterparts are the posterior axio-appendicular muscles. Now, the third group is going to be the scapulohumeral muscles, which, as their name implies, would begin on the scapula and end on the humerus. Let's now take a closer look at these three groups of muscles individually. The first group, the anterior axio-appendicular muscles, is a group of four different muscles. The largest and most superficial and prominent of these is the pectoralis major. Now, the pectoralis major is a large dynamic mover of the upper limb that begins on the sternum and the clavicle as well as the costal cartilages, and it's going to insert on the humerus. If we hide the pectoralis major, we can see the other three muscles more clearly, including the pectoralis minor, which is going to be positioned deep to pectoralis major and attach from our second, third, and fourth, or in some cases the fifth ribs, up to the coracoid process of the scapula. Inferior to the clavicle, we see the small subclavius muscle. This small muscle is going to assist in pulling down our shoulder by pulling down on the clavicle. Now, the fourth of these muscles is the serratus anterior. This large muscle is going to attach in a serrated or jagged appearance to our ribs after originating from the medial aspect of our scapula. So the serratus anterior is going to be in this anterior axio-appendicular group due to its anterior attachments along the ribs. The next group of muscles are the posterior axio-appendicular muscles. And here we're going to see 2 large muscles more superficially oriented and 3 muscles more deeply located. The first of these is a large diamond-shaped muscle in our back that is positioned more superiorly. And this muscle is the diamond-shaped trapezius or square-shaped trapezoidal-shaped muscle. Inferior or deep to this muscle, we see the large, broad, flat muscle of the latissimus dorsi. So these first 2 muscles are more superficially located, and they're going to take up a lot of room and create large dynamic movements similar to what we saw with pectoralis major anteriorly. Now, deep to the trapezius, if we were to hide this muscle, which we have done on the left side of this specimen, we can see the 3 underlying deep muscles, beginning superiorly with the levator scapulae, the intermediate muscle, the rhomboid minor, and the most inferiorly, the rhomboid major. Now, the rhomboid major is going to be positioned most inferior, and it's going to be a rhombus in shape, as is the rhomboid minor. The rhomboid minor we can identify due to its close proximity to the spine of the scapula, while the rhomboid major is positioned inferior to it along the medial border of the scapula, and lastly, the levator scapulae positioned superior to that spine of the scapula. The last of the 3 groups we're going to take a closer look at in more detail, and this is going to be the scapulohumeral muscles. Now, the scapulohumeral muscles are going to be attaching, as their name implies, from the scapula and attaching on the humerus. These are going to include the large deltoid muscle, which is triangular in shape on our lateral aspect of our shoulder, the teres major muscle, which will be positioned inferior to the teres minor muscle. Now, the other 4 muscles in this group are going to form part of a group of muscles known as the rotator cuff, and we'll take a closer look at them in more detail in a moment. There are 4 muscles that comprise the group we commonly refer to as the rotator cuff. Now, the rotator cuff serve together to form a common action. These 4 muscles will contract to create tension here at the shoulder joint, which provides stability. By hiding the connective tissue, we can see the underlying head of the humerus, which will be better kept intact with the glenoid fossa of the scapula as these muscles contract as a unit. Now, individually, the 4 muscles are going to have independent functions, or they'll work with other groups of muscles to perform an action. However, collectively, know that the rotator cuff serve to provide shoulder stability by keeping the head of the humerus tight against the glenoid fossa. To help you remember the 4 muscles of the rotator cuff, I like the mnemonic SITS, S-I-T-S, which helps you remember the first letter of each of the muscle names. For orientation, begin by identifying the spine of the scapula on the posterior aspect of this bone. Then progress superiorly to identify the supraspinatus muscle. The supraspinatus muscle is going to act to help raise our shoulder in the motion known as shoulder abduction. Now, other large muscles are going to contribute to this dynamic movement. However, the first 15 degrees of motion are going to be provided by the supraspinatus muscle. So, the supraspinatus will begin to contract, the upper limb starts to move away from the body, and now it's at a point for muscular advantage of the other muscles to kick in and help to continue the motion of raising our shoulder. The infraspinatus muscle is going to be located inferior to the spine and, combined with the teres minor, assist in the action of lateral rotation of the upper limb, or in particular of our humerus. So here we can see the teres minor and the subscapularis both contracting along with the deltoid to produce lateral rotation of our upper limb. The last of the 4 rotator cuffs is located anteriorly, and the subscapularis is therefore going to produce a counter movement to the infraspinatus and teres minor. And this is going to be medial rotation of the upper limb. Now, medial rotation is a much stronger, more dynamic movement due to the presence of the other large muscles in the region which assist with this action, including teres major, latissimus dorsi, the deltoid, and pectoralis major. By fading these large muscles, we can see when subscapularis is activated to assist in medially rotating the upper limb. Now, commonly we hear about the rotator cuff when it comes to an injury, and the most commonly injured of these 4 muscles is the supraspinatus muscle. So, the shoulder is going to become aggravated and cause pain when we abduct the upper limb. As this muscle contracts, it is going to cause a pinching or a tightening sometimes within this region superior to the supraspinatus as it passes deep to the acromion process of the scapula. So, although the most commonly injured of these is the supraspinatus, this is going to lead to shoulder instability as a group because they can no longer as effectively keep the shoulder stable up against the scapula. Before taking a closer look at the actual muscles within the arm, I want to discuss the idea of compartments. Before we do so, recall that the arm is the region of the upper limb located between the shoulder and the elbow, while the forearm is the region between the elbow and the wrist. So if I'm describing muscles of the arm, be sure that you're thinking of this region between the shoulder and the elbow. Within the arm, we're going to divide this up into 2 different compartments. We're going to see that there's an anterior compartment of the arm, which will be located in front of or anterior to the humerus, and a posterior compartment of the arm, which will be located posterior to or behind the humerus. Now, it's often easiest to understand how these structures are organized by taking a closer look at the arm with a cross-sectional view in mind. So what we're going to do is take a look at a cut through the entire arm at the same time and discuss some of these structures in more detail. Typically, when we look at a cross-sectional cut of a region, we'll be looking at it from an inferior to superior perspective, because this is how diagnostic imaging is done. You would be standing near the patient's feet and looking towards the patient's head. So it's a good orientation to be familiar with of looking from an inferior to a superior perspective. The first thing to look at with the cross-sectional cut of the arm is that this is essentially a round structure. So that will be an indication that we're looking at a cross-sectional cut somewhere in one of the limbs. Now, the next thing to identify is if there's 1 bone or 2 bones within this region. In this case, we have 1 centrally located bone, which is going to be the humerus. Anterior to the humerus, we are going to have the anterior compartment of the arm, with 3 different muscles shown here in cross-sectional cut. We're going to go into more detail about what these muscles are, but for now, realize there's going to be a subdivision between the group of muscles located in front of or anterior to the humerus and those located posterior to it. The posterior compartment of the arm has been highlighted in pink. And although this looks like there's multiple components, which there are, they're actually all of 1 large muscle, which we'll look at in more detail with the posterior compartment of the arm. What I wanted to highlight here in this cross-sectional cut is not only the fact that they're going to be located in front of or behind the humerus, but that there's going to be additional structures within these compartments. So it's not just muscles in isolation. For example, within the anterior compartment of the arm, we're going to need a nerve to make those muscles move, which is going to be the musculocutaneous nerve. And we can see that it is sandwiched within the different muscles within this compartment. Similarly, near the posterior compartment of the arm, we're going to see a nerve known as the radial nerve, which is responsible for providing motor innervation to the muscles within this posterior compartment. Now, beyond the arm or distal to it, we're going to need more nerves to reach the forearm or the hand. And that's what we're going to see medially here with the median nerve and the ulnar nerve. So although they don't reach target structures within the arm, they need to continue to the forearm. So they will pass through the arm to get to those targets. Additionally, after nerves, we're going to see the presence of blood vessels. We can see on the medial aspect of the arm a large artery. This is known as the brachial artery. Recall that the brachium is another name for arm. So the brachial artery will be the key artery within the arm. We're going to have some deep veins located near that brachial artery and a couple of superficial veins also traversing through the region of the arm, namely the basilic vein and the cephalic vein. So I would strongly recommend, after looking or listening to some of these other recordings and lectures on the components of the arm, to come back and revisit this one to better understand the different compartments and structures within a cross-sectional view. There are 3 muscles in the anterior compartment of the arm. And if you remember that the arm is also known as the brachium, the names will make a lot more sense. As we see, all of these muscle names have brachii in the name, which helps you remember that they belong to the arm. The first of these muscles is located most superficially, and it has 2 components, a more laterally located long head and a more medially located short head. Biceps actually means 2 heads or 2 bellies. So this muscle, the biceps brachii, is a 2-headed muscle of the arm. The long and the short refer to the length of the tendon. So as we come more superiorly here and we look at the shoulder, we can see that one of these tendons has a much longer route than the other. The long head of the biceps is a much longer tendon than the short head of the biceps, and that's where their names come from. The second muscle that we're going to see here in the anterior compartment of the arm shares an attachment with the short head of the biceps. This muscle is the coracobrachialis. Now, the coracobrachialis, as its name implies, will attach from the coracoid process of the scapula to the arm, or the brachium. And we can see here that this muscle is tucked underneath or deep to the short head of the biceps brachii. The last of these 3 muscles is the brachialis muscle, or the muscle of the arm. Now, the brachialis muscle only crosses the elbow, and it's going to attach to the ulna, unlike the biceps, which attached to the radius. As we look at the actions of these muscles and you think about which joints they cross, those are the joints that will have movement associated with muscular contraction. If I select the biceps brachii and we look at the motions of this muscle, you can see that it's going to assist in elbow flexion as it passes the elbow joint. It's also going to assist in shoulder flexion as components of this muscle cross the shoulder as well. Now, if we look at other actions provided by the biceps brachii muscle, we can see that it's also going to produce another action in the forearm, and this is supination. So as the muscle contracts, it's going to straighten our wrist back out after you pronate it. So pronation will tilt the hand to face posteriorly or in the back of the body, while supinating is going to return it back to anatomical position. If you remember these actions and you think about going to the gym and you want to lift weights and strengthen the anterior compartment of your arm by doing forearm curls, what you're going to see is that you can lift more weight in a fully supinated position than you can in a pronated position. The reason for this is once we have supinated, the biceps can now focus on flexion of the elbow. But while it is pronated, it is going to spend its energy trying to twist that forearm back into anatomical position. So the dominant elbow flexor, whether we're in pronation or supination, is actually the brachialis muscle. Now, the biceps typically gets the credit, and that's the one that we see more superficially and it's more pronounced. But just remember that these muscles are all going to be named based on their location, their orientation or sites of muscle attachment, and their actions are going to be related to the joints that they cross. The posterior compartment of the arm consists of one large dominant muscle, the triceps brachii. Now, as its name implies, this is a three-headed muscle of the arm. The long head of the triceps brachii is going to cross both the elbow with the other two heads and the shoulder by itself. This is the only one of these three heads that crosses both joints. And as we can see, the long head is going to split in between the teres minor and teres major muscles near our shoulder. The long head is situated most superficially of these three components of the triceps and the most posteriorly. On the medial aspect, we're going to see the medial head of the triceps brachii. And if I fade the long head, you'll be able to see that the medial head passes deep to a large portion of the long head, and it's going to be positioned side by side with the third belly or the lateral head of the triceps brachii. So the medial and lateral heads will be positioned side by side against one another along the humerus, and the long head will be positioned more superficially. The other muscles in this region are going to originate in the posterior compartment, but also cross the elbow, and that is the brachioradialis and the anconeus, which we will see later on in the forearm. Before taking a closer look at all of the muscles within the forearm, I want to go over the idea of compartments within this region. So recall that the arm was the area between the shoulder and the elbow, while the forearm is going to be the area between the elbow and the wrist. And there's going to be a lot of small muscles within this region that are going to help perform all of the small, fine movements within our hand and our wrist. These muscles are going to be grouped into two different compartments. An anterior compartment of the forearm, which will be located more anteriorly and medially, and found anterior to or in front of the two bones within the forearm, the radius and the ulna. While the posterior compartment of the forearm is going to be more posteriorly and laterally located, and it will again be located posterior to or behind the bones within the forearm, the radius and the ulna. To better understand the compartments of the forearm, let's take a closer look at a cross-sectional cut through this region of the upper limb. Recall that within cross-sectional views for diagnostic imaging, we'll be looking from the feet of the patient back up towards the head, so from an inferior to a superior perspective. The first thing to notice within this cross-sectional cut is again the round appearance of the entire region. Next, we would look for the location of the bones, beginning with the two deeply located bones, the more laterally located radius and the more medially located ulna. Now, depending on where we are within the forearm, which one is closer to the surface or their orientation relative to the muscles within the anterior and posterior compartments might vary a little bit. However, we're still going to see two bones throughout the entire length of this cross-sectional cut. Connecting the more laterally located radius and the more medially located ulna, we're going to have a strong connection of fibrous tissue, known as the interosseous membrane. And this will help further subdivide these two compartments of the forearm. In blue, I've drawn the more anteriorly and medially located anterior compartment, which is going to contain the flexors of our wrist and hand. While in green, I've drawn the posterior compartment muscles, which are going to be extensors of the wrist and hand and located posteriorly and laterally within the forearm. Similar to the arm, we're going to have different structures besides just the muscles that we can see within each of these compartments. We'll begin by taking a closer look at the nerves. Recall that there's going to be nerves passing from the arm into the forearm, two of which are going to be responsible for providing motor innervation to the anterior compartment muscles. These are going to be the median nerve, which is closer to the midline of the forearm, and the more medially located ulnar nerve. Within the posterior compartment, we're going to have branches of the radial nerve. And here we can see one of the superficial branches traveling along the lateral aspect of the forearm. We're also going to see within this cross-sectional cut some of the vasculature. We can see a more laterally located radial artery and a more medially located ulnar artery. So the names of these vessels will correlate to the bone that they are closer to. We're also going to have deep veins next to those arteries and the superficial veins coursing within the subcutaneous tissue, namely the cephalic vein more laterally and the basilic vein more medially. So similar to the compartments of the arm, I recommend that you look at the compartments of the forearm after having seen the muscles and other neurovascular structures within this area in more detail. The muscles in the forearm can be quite complex and intimidating when first looked at. There are a lot of muscles in this region, and some of them have very long names that might be intimidating at first. However, if we look at how these muscles are organized and how their names make sense, we can break it down more methodically and really start to understand how this region of our body is organized and how the muscles are named. The first thing that I do as I look at the forearm muscles is identify the brachioradialis muscle. Now, the brachioradialis originates in the posterior compartment of the arm, but it crosses anterior to the elbow to insert at the styloid process. And this muscle produces elbow flexion, especially in a mid-pronated position. Now, by identifying the brachioradialis first, we can start to split the forearm into two different groups. A group of muscles that originates on the medial side from the medial epicondyle at our elbow, and we see its tendons passing anteriorly down into the palm of the hand. As a group, these muscles produce flexion of the wrist or of the digits. So we often refer to this compartment as the flexor compartment of the forearm. Now, the flexors are going to be arranged in different layers. The other group of muscles, after identifying brachioradialis, are going to be found on the lateral aspect of the forearm, and these are going to be known as the extensors. So they will arise from the lateral epicondyle, or the lateral side of our elbow, and aim more towards the dorsum of the hand. And as these muscles contract, the tendons are going to produce extension of the wrist or of our digits. So the first thing to look for is brachioradialis, and then we identify, are they more anteriorly located going to the palm, or are they more posteriorly located going to the dorsum of the hand, which will tell us if they are flexors or extensors. The next thing we want to do is look at, are these tendons going to be on the outsides or the insides of the wrist? Now, if they're going to be on the outside, they often have carpi in the name, or they're going to be going to a digit in the midline. So here we can see that some of these are going to be coming towards the wrist, and their name will have carpi in the name. If they go to a digit, they're going to have digit of some form in their name, or they may go to the thumb and have pollex in their name. So as you look at the target of each of these tendons, it will help you identify what is the name of that structure. Next, what we want to do is verify if these tendons are going to be on the radial side or the ulnar side of our forearm. So we've evaluated what is their target. Does it go to the wrist, to a digit, or to the thumb? And now we're evaluating, is it on the radial or lateral aspect of our forearm, or the ulnar or medial side? Now, as the forearm can rotate, you may want to use a reference like the thumb to help you identify if this is the radial side of the forearm, and the pinky to help you identify if this is the ulnar side of the forearm. The last thing that we want to check is, does it have a long or a short tendon? And this will help you with the last of the names, which is brevis or longus. Now, a longus tendon is going to have a longer route or a longer length of tendon than would a brevis. So brevis means short, longus means long. And that will be again related to the length of the tendon. So before worrying about the actual individual names, break it down and look for, is this on the anterior side as a flexor? What is it affecting? And does it have a long or a short tendon? The anterior compartment of the forearm consists of 3 different layers of muscles. But before we start looking at the different muscles and all of their names, let's recall the strategy for how they are named. The first term is going to tell you what the action is. So it's going to differentiate as a flexor versus an extensor in many cases. The second term, if it has 3 names, is going to tell you the target structure, whether that's the wrist or the digits, while the last name will be a descriptor of some sort. Let's now take a closer look at the first or the superficial layer of the forearm flexors and follow this naming protocol. The first of these muscles is named the pronator teres, and as we would expect, the first word is the action and the last word is a descriptor. So this is going to produce pronation of our forearm by a round muscle, teres meaning round in Latin. We can see that this will be assisted by another square-shaped muscle that is the pronator quadratus, or the pronating muscle that is square-shaped. Next to the pronator teres, we see that the flexor carpi radialis is going to begin near the medial epicondyle of our humerus, cross the wrist, but it'll be positioned on the radial side. So this is a flexor of our wrist on the radial side. The next muscle that we see is the palmaris longus, and the palmaris longus is going to be a long, thin, tendoned muscle that crosses superficial to the flexor retinaculum. So this is the only tendon in our wrist that crosses superficial to this thick band of connective tissue, and that will help you identify this muscle if present. Not everybody actually has a palmaris longus muscle. The fourth of the superficial flexors is the flexor carpi ulnaris, or the flexor of the wrist on the ulnar side. And we can see that this is the largest of the 4 superficial flexors, and it's also going to assist in medial deviation of our wrist. Now the 4 superficial flexors are located superficial to the intermediate or second layer, which actually only has 1 muscle in this layer. And don't be fooled by the name, the flexor digitorum superficialis. This tells us that this is a superficial muscle when compared to its counterpart, the deep, but it is not part of the superficial compartment muscles. The name of this muscle is the flexor digitorum. Therefore, it flexes the digits, but it is more superficially located. The third layer, or third set of muscles in the forearm, are the deep group or deep layer muscles, and there are going to be 3 muscles found in this most deep layer. The flexor digitorum profundus is the counterpart I spoke of a moment ago. So this will be the flexor of the digits that's more deeply located. And as we can see, the flexor digitorum profundus, as was the case with the superficialis, splits and sends a tendon to each of our 4 digits, excluding the thumb, which is not considered a digit. This muscle, the flexor pollicis longus, takes care of the thumb for us. And as its name would imply, it flexes the thumb but with a long tendon. What we'll see is there's a counterpart, a flexor pollicis brevis, located in the hand itself. The third muscle in this third layer is the pronator quadratus, which is the square-shaped pronating muscle we first saw assisting the pronator teres. So as you look at the muscles here in the anterior compartment of the arm, recall their action, then their target, and lastly, a descriptive term. Unlike the anterior compartment of the forearm muscles, the posterior compartment of the forearm muscles really are all found more or less in one layer. Now, these muscles are going to start with the same key identifier as we did with the anterior compartment, which is the brachioradialis. So this landmark muscle will identify if we are going to be on the anterior or the flexor side of the forearm or the posterior or extensor side of the forearm. Now, once you've properly identified the brachioradialis, we're going to follow a similar naming protocol that we did with the anterior compartment muscles, meaning that these muscles are going to be named first with an action descriptor, and then they'll tell us what target structure, and lastly have a descriptive term. So we're going to see that as we begin with the brachioradialis as our landmark muscle, we can then start to progress down the lateral side or the radial side of the forearm with an accurate description of these muscles. The first name tells us the action, so these will be the extensor muscles of the wrist on the radial side with either a long or a short tendon. So the extensor carpi radialis longus muscle has a long name. However, it's a very descriptive name that will tell you exactly where it goes and what it does. So this is an extensor of the wrist on the radial side with a long tendon. Located immediately deep to this muscle, we see the extensor carpi radialis brevis muscle. Now, the extensor carpi radialis brevis muscle is going to be located deeply to the extensor carpi radialis longus muscle. The length of the tendon is going to differ. So the longus will have a longer tendon and the brevis will have a shorter tendon. The abductor pollicis longus is sort of an exception in this region. However, it's going to have a similar naming protocol. It abducts or abducts the thumb, its target, the pollex, with a long tendon. And the reason I call it an oddball is it's one of the few that does not have extensor in the name in this posterior compartment. So the abductor pollicis longus muscle is going to cross superficial to the tendons of extensor carpi radialis brevis and longus. As we continue moving down the forearm, we're going to encounter two muscles that extend the thumb, one with a short tendon and one with a long tendon. So here we see that we have the extensor pollicis brevis next to the extensor pollicis longus. Now, interestingly enough, once you have identified the brachioradialis muscle, these muscle names are all going to alternate with their last term being longus, then brevis, back to longus, to brevis, back to longus. So every other term switches. So we have extensor carpi radialis longus, then extensor carpi radialis brevis. The abductor pollicis longus is going to be in between the two extensors of the wrist and our two extensors of the thumb, the extensor pollicis brevis and extensor pollicis longus. Now we see that all of these tendons are going to pass deep to the extensor retinaculum, and all of those 5 muscles are on the radial or thumb side of our forearm. In the middle of the posterior forearm, we see the extensor digitorum. Now note that there is no longus or brevis or superficialis and profundus with this muscle. It is simply known as the extensor digitorum. So extensor of the digits. Now on the most medial side or ulnar side, we see the extensor carpi ulnaris. And as its name would imply, this is going to be the extensor of the wrist on the ulnar side. And compare that, there's only one extensor carpi ulnaris Well, we had two, extensor carpi radialis longus and extensor carpi radialis brevis, on the radial side. The last two muscles only go to one target finger, the extensor digiti minimi and the extensor indicis. So there's a tendon located deep here to the extensor digitorum that goes to only the index finger, and an extensor of the little finger that only goes to the pinky, and that will be on the medial or ulnar side of the extensor digitorum. There are 15 intrinsic muscles in our hand, meaning that these muscles begin and end within this region of our body. Now, rather than taking a look at all of these named individually, what we're going to do is consider them as a part of 4 different groups. The first group are known as the thenar muscles. These 3 muscles are going to affect movements of our thumb. And as you look at the names of those muscles, they will tell you a more accurate description of what action of what structure with a descriptor, similar to how the names in our forearm worked. So here we see the abductor pollicis brevis, which tells us that this shorter muscle abducts the thumb. The 3 thenar muscles are located on the radial or lateral aspect of the hand. Their counterparts are the hypothenar muscles, which are located on the medial aspect or ulnar side of our hand, coming towards the little digit. Separating these 2 groups of muscles, the thenar and the hypothenar, we see the palmar aponeurosis. This thick, strong connective tissue is going to be connected to the tendon of the palmaris longus muscle. So recall that the palmaris longus muscle went superficial to the flexor retinaculum, and it's going to attach to this thick connective tissue in the palm of our hand, the palmar aponeurosis. If I hide the palmar aponeurosis, we can more clearly see the other 2 deep groups of muscles. The first of these are the lumbricals, and there are 4 lumbricals. The lumbricals mean worm-like, and these small muscles are going to attach on the radial side of the flexor digitorum profundus muscle tendons. So the lumbricals are going to cause action at our metacarpal phalangeal joints as well as the interphalangeal joints. The interossei are the muscles in between the bones of our hand. We're going to have 2 sets, a palmar set of interossei closer to the palmar surface and a dorsal set of interossei towards the dorsum of our hand. Now, in further courses, you may look at the names of these individually, but for now, just lump them into these 4 categories: thenar muscles, hypothenar muscles, lumbricals, and interossei.